Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location at Northern Virginia Dermatology, Vein and Surgery Center in Ashburn, Virginia, discussing the latest techniques in vein care and how they can help restore your legs and eliminate those unsightly veins with two of this area's top vein care specialists, Dr. Marlon Maragh and Dr. Sherry Maragh. Dr. Marlon Maragh is a board-certified radiologist by the American Board of Radiology and received his medical training at Yale University. Dr. Sherry Maragh is board-certified in general, surgical, cosmetic, and laser dermatology by the American Board of Dermatology and received her training at the very prestigious Mayo Clinic. Welcome, Dr. Marlon Maragh and Dr. Sherry Maragh, who's back for the fourth time here on A New Me.
Thank you.
Our pleasure, and it's your first time, in fact, with us, Dr. Maragh, and I want to start with you, if I may, if you can please begin by telling us what are the most common vein problems that folks experience.
Well, one of the more common vein problems are varicose veins. Varicose veins are large bluish veins that are sometimes ropey underneath the surface of the skin that cause patients problems.
How do they occur?
They occur mostly by, you have one-way valves inside the veins, and when those valves go bad, you start getting what's called venous reflux, venous insufficiency. You start getting increased size of the veins and pain and other symptoms.
Dr. Sherry Maragh, I wanted to ask you if you could please tell us about the spider veins.
Right, that is one of the second most common types of leg vein problems that patients come in to see us with. The spider veins appear on the skin as small clusters and starbursts on the skin. They're typically reddish or purplish in color. They typically occur from some of the same factors that are associated with varicose veins.
And what factors would you say, Dr. Maragh, can cause venous disease?
There are a lot of factors. One of the biggest ones is genetic predisposition. So for instance, if your parents or grandparents or any other family member has venous insufficiency, you're at higher risk for that. Some other factors include pregnancy, weight gain, prolonged standing, high-heeled shoes.
Would you like to add anything to that, Dr. Maragh?
Yes, sometimes patients can experience one without the other. Some patients will come in presenting with spider veins and have no signs, overt signs of varicose veins, and sometimes they will come in with varicose veins with no signs of spider veins. With spider veins, some of the same contributing factors are present. Prolonged standing, wearing of high heels, women, history of pregnancy, and the genetic factors as well.
And Dr. Maragh, why does it occur more frequently in the legs as far as the vein problems that you both have been describing today?
It's more frequently in the legs because of the increased pressure from standing and also just the increased distance for blood flow return back up to the heart against gravity.
And who would you say, Dr. Maragh, is at risk for varicose veins?
So men and women are both at risk for varicose veins. Women tend to present more commonly because of there are usually more risk factors with women. But you can see varicose veins and other venous disease as early as the teenage years.
That young?
Yes, absolutely.
And who would you say, Dr. Maragh, is at risk for the spider veins?
Spider veins, same thing, same catch group. It can happen to anyone, but in this instance, women are more commonly affected. The spider veins often happen on the lower legs, primarily the calves, sometimes around the ankles, in women who wear high heels, who have prolonged standing, all of those things. So we do tend to see women presenting with spider veins a little bit more frequently than we see men.
What are the symptoms as far as these vein problems go?
Symptoms can range from having no symptoms at all to having pain, achiness, tiredness, easy bruising. In some of the more advanced stages of the disease, patients can have pigmentation, particularly around the ankles, as well as ulceration.
Following up on that, Dr. Maragh, beyond these veins being unsightly, do they pose any health risks as well?
Varicose veins can pose health risks associated with poor circulation and blood flow. Spider veins in and of themselves usually are not health risks. However, they usually are signs of early venous disease.
There have been significant advances in vein treatment over the years, and I wanted to see if you could please tell us about what they are.
Well, with the smaller veins, there have been significant advances. The most common treatment over the years has been sclerotherapy, and that treatment method does still exist. However, there are several different solutions that we use now, as opposed to the typical saline that has been used over the decades. Now there are solutions that are used that cause a lot less pain, discomfort, as well as side effects after the procedure is completed. In addition to sclerotherapy, there's now laser that is available to treat spider veins. Laser actually results in a significant resolution of those spider veins, sometimes faster than sclerotherapy, depending on the patient. It does require multiple treatments, such as sclerotherapy does as well, but sometimes it eliminates the need to wear compression stockings afterwards, as well as prolonged sun avoidance after the procedure, which is important for those patients who are undergoing the procedure in the summer months.
Please tell us regarding the advancements as far as varicose veins go.
Yes, well now there's endovenous laser ablation, which is a minimally invasive procedure which patients love, and it's pretty much replaced vein stripping, which was done a lot in the past. There is decreased downtime, decreased bruising, decreased pain, and a very high success rate.
We're now going to see both the doctors perform some procedures.
Now, with laser treatment for treatment of spider veins, a small amount of ultrasound gel is applied to the treated area. That helps with the effect of the laser as well as cooling of the skin for the patient. The laser is then applied to the skin. This cooling plate helps to chill the skin and makes the procedure more comfortable for the patient. After the skin is chilled, the laser beam is directed over the involved area of the vein and the laser is fired. Post-cooling is applied to the skin to keep the patient comfortable, and also it decreases any side effects to the skin, such as blistering or burning. And you can see as the vein is treated, it slowly begins to disappear. Constantly cooling the areas that have just been treated. And you can see after one treatment session, the patient has experienced significant decrease in the appearance of this cluster of spider veins. Now, this patient will return in 2 to 4 weeks for additional treatment to this area if necessary. For a period of 2 to 4 weeks after the treatment, she will continue clearing of the leg vein post-procedure. This same procedure would be repeated on any other areas of involvement on her skin. The same cooling gel as well as a cooling plate would be applied to the involved areas throughout the treatment.
So this patient's already had an ultrasound evaluation and was determined to already have venous insufficiency. And when they come in for their procedure, we again look at the leg of concern and map out the veins that are going to be treated. The main vein that's usually treated is the great saphenous vein, usually seen in the sheath in the center of the screen. As you can see, there are also some large branching veins that are a little closer to the surface of the skin, which is up at the top of the screen. Now, the way the procedure works, it's with ultrasound guidance. After this is all mapped out from basically below the level of the knee up to about the groin area here, we puncture the skin with a needle into the great saphenous vein, right about here. Then what we do is insert a wire in through the needle up to, again, the saphenofemoral junction up in the groin area. Through a series of wire and catheter exchanges, then we then have a laser fiber that's through here, through this small hole, into the great saphenous vein and up to about this level here. Once the fiber is in good position, we're ready to turn it on with the appropriate settings and slowly pull it back until the entire vein is ablated. The patient relaxes for the rest of the day. The following day, they are back on their feet, back to work, just no strenuous activity. That's the beauty of this procedure.
We're now back with Dr. Maragh and Dr. Maragh. I must say, what we just saw here with both of you performing the different procedures and the treatments, you could see the results were literally instantaneous. Very natural and very effective indeed.
Absolutely.
Dr. Maragh, how long do these results last? What are we looking at?
Well, the treated vein is permanently eliminated. The endovenous laser ablation procedure is 97% effective for treatment of the vein.
That's very high.
Yes, absolutely. It's a great success rate.
Yeah.
Any incompetent veins also feeding into the vein that's been treated may also improve. Now, patients who have many risk factors may eventually develop other spider veins and varicose veins later in life, but those can also be reevaluated and perhaps treated later.
Are there any follow-up visits, Dr. Maragh, that people be looking at for either the varicose or spider vein treatments that you both have described today?
For follow-up for the varicose veins after the endovenous laser ablation procedure, we typically see our patients back for a post-operative ultrasound to ensure success of the procedure, approximately 4 weeks post-operatively. With the spider veins, multiple treatments are required. We usually tell our patients to prepare from anywhere from 2 to 5 treatment sessions, and it really depends on the patient how many treatments are required. They will, however, see improvement after each and every treatment session. The treatments are typically timed anywhere from 2 to 4 weeks apart.
Dr. Maragh, does insurance typically pay for these procedures that you both have described today?
And that's a great question a lot of patients ask. If under ultrasound evaluation, if your varicose veins meet certain criteria for size and reflux, then insurance companies will, for the most part, reimburse with no expense to the patient. However, with spider veins, that's always considered cosmetic, and that's not typically reimbursed.
You've really helped us. You've helped us understand, and we know what options are available. And on that note, I would like to thank you both for joining us and being guests on A New Me. It was our pleasure.
Thank you.
Thank you.
Our pleasure as well.
Thank you very much.